I spent many years as a middle school teacher, spending a lot of time with 12-year-olds. So I've learned a lot along the way. I also coached volleyball, basketball, and track. But one of the things I always tell people, and really learned this really the hard way of losing our daughter to suicide, was we need to talk about mental health just like you would talk about physical health. So if your child hurt their ankle at school and you got a call, or they came home with it wrapped, or they were limping, you would ask them about it. We need to make it as simple to talk about our mental health. And one way to do that is modeling it ourselves. If we talk about our mental health, it'll be easier to talk to our young people, our kids, about their mental health. Make it as common as you can be. We also, you can print off a feelings wheel. Have it on your table. When you sit down with your kids, hey, identify your feelings today. Happy, mad, sad, whatever it is. But another thing I always like to tell people, and I like to tell kids this especially, try not to say, I am angry. Try to say, I feel angry, because our feelings are fleeting. They change. We are not our feelings. After we lost Ella and I went back to my 7th grade classroom, I couldn't overwhelm my students, but I also had to be real that there were some times that I was going to be very, very sad. And they would ask me about it. But I also learned a lot of tools along the way. And at the defensive line, we say we put them in our mental health locker. But one thing that I've learned, Chris Solomon and I have done so much therapy. We did therapy individually. We did therapy together. The 3 of us did therapy together. Certainly it saved our family. And if you have the resources, don't be afraid to do therapy. With my students, I'd learned breath work, and I meditate. I keep gratitude practice. I'm grateful for 5 people every morning before I got out of bed. But the one thing I did with my students was breath work. So we would start breathing exercises before testing. And I started having kids request to come into my classroom to test. And the principal came by and he goes, why are students asking to be in your room? What's going on? And sure enough, they were calm. They weren't scared. We did breath work together. And I continued that in my classroom. But just some really simple tools. It's not rocket science. It's taking the time. It's finding out where you are. As a parent, you have to ground yourself first and then handle issues with your kids, with your friends, with your spouse, with your siblings.